Breath sounds. Breath sounds are produced by vibrations of the vocal cords due to turbulent flow of air. Breath sounds have intensity and quality. The intensity or loudness of the sounds may be normal, reduced, or increased. Vesicular breath sound. The quality of normal breath sounds is described as vesicular. Normal lung tissue makes the sound quieter and selectively filters out some of the higher frequencies. Character. It is low-pitched, rustling in nature, and is produced by the attenuating and filtering effect of the lung parenchyma. Duration of the inspiratory phase is longer than the expiratory phase in a ratio of 3:1. There is no pause between the end of inspiration and the beginning of expiration. Conditions with diminished, vesicular breath sounds. Bronchial asthma, characterized by a silent chest. Tumor. Small pleural effusion. Pleural thickening. Collapsed lung with occluded bronchus. Emphysema. Bronchial breath sounds are produced by passage of air through the trachea and large bronchi, heard over an area of diseased, airless, or consolidated lung, interposed between the bronchi and chest wall. Character. It is loud and high-pitched, with an aspirate or guttural quality. The duration of inspiration is shortened, whereas that of expiration is prolonged. Sometimes, the duration of inspiration and expiration are equal. There is a pause between inspiration and expiration. Types of bronchial breath sounds include tubular, cavernous, and amphoric. Tubular breath sound. They are high-pitched. They are heard in the presence of pneumonic consolidation, collapsed lung or lobe, when a large draining bronchus is patent, above the level of pleural effusion in a partially collapsed lung with a patent bronchus. Cavernous breath sound. They are low-pitched and heard in the presence of thick-walled cavities with a communicating bronchus. Amphoric breath sound. They are low-pitched, with a high tone and a metallic quality. They are heard in the presence of large superficial, smooth-walled cavity, bronchopleural fistula, and tension pneumothorax. Broncho-vesicular sounds. It is intermediate between bronchial and vesicular breathing. It has intermediate intensity and pitch, with the same duration of inspiratory and expiratory phase. It is normally heard anteriorly over first and second intercostal spaces, and between scapula posteriorly. It is abnormal in other locations. Absent breath sounds can indicate massive pleural effusion, thickened pleura, collapsed lung or lobe when bronchus is occluded, pneumothorax, near-fatal asthma, pneumonectomy, or agenesis of lung. Added sounds. Adventitious or added sounds refer to sounds that are heard in addition to the expected breath sounds mentioned. They include crackles, rhonchi, wheezes, stridor, and rubs. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.